The final speaker this afternoon is Dr. Megan Jeon, a postdoctoral research fellow for POWH at the University of Sydney. Megan's going to talk to us today about identifying patient needs and dealing with uncertainty. Can I just quickly, before Megan comes on, just to remind or mention that you will get surveys sent to you via email if you can respond to the survey, just so that we can make these things better for people and make them poignant for people. The people on the webinar will also, I think there'll be a survey at the end of the webinar, plus they will get one emailed to them. Any resources from today, I think, will also be emailed for those that registered. Thank you very much, Megan.
Thanks, Marina, and thank you for the opportunity to be here and present some of our work today. So, in this final talk of today's session, I would like to shift our attention a little bit to looking at some emotional impact of facing with uncertainty and also at the time of tumor recurrence or progression. So this program, the BRAINS program at the POWH, University of Sydney, is funded by MRFF, Australian Brain Cancer Mission Brain Cancer Survivorship Grant. So just to give you a brief overview of the talk today, I'll be looking at dealing with uncertainty, how we can identify the things you might need some help with, and what we brains have been working on to help support with some of the most common symptoms and concerns you may experience, such as emotional difficulties, cognitive changes, and fatigue. And lastly, I'll be briefly talking about fear of cancer recurrence and our plans for the future in this area. So uncertainty is quite a common feeling and experience, which can be even more increased around the time of tumor recurrence or progression. As a patient, this uncertainty can be about worrying about tumor recurrence and how it actually might show up for you, because everything is in the brain and we can't really examine or see it. And so you might be looking at some subtle neurological changes or any changes in your behaviors or personalities, the way you sort of react with people. So some of the things you might be thinking can include, will I be able to do things myself, or what if I change, what if my relationships with people around me change. But also at the time of tumor recurrence, a lot of people, a lot of patients and caregivers as well reported that it felt like a constant balancing act between the need for maintaining the hope and positive outlooks for the future, but also at the same time having this need for information, support, and preparation. And as we all know, many caregivers also experience uncertainty throughout the tumor journey and tumor treatment and beyond. And as a caregiver, there may be an additional factor of the need to protect your loved one and other family members, as well as sort of making a lot of decisions as part of the care team for your loved one, and looking to maintain the best possible social support and medical care at the same time. And many caregivers may face their own grief and worries, which is not always obvious or talked about in the clinic settings. So this uncertainty, I guess, is very much linked to not knowing and having little control. This can relate to the prospect of death, leaving families behind, and also having to re-experience the uncertainty, distress, and some of the side effects from any treatment that you may choose to receive. To effectively deal with this uncertainty and distress, we can actually target this very aspect of uncertainty, of not knowing and having little control by actually, firstly, screening and assessing the level of distress, as well as other things you may need help with. And we do that regularly and proactively. Secondly, once we understand what kind of things you need help with, individually tailored information is provided when it's needed the most, and it can be about the tumor or treatment options and potential outcomes, or any other psychosocial issues that you may be experiencing. And I think today's session is just giving the broad spectrum of information that sort of related to tumor recurrence and progression, which is very valuable in fighting against the uncertainty, I guess. Thirdly, cancer treatment, palliative care, and supportive psychosocial support are all planned with you and your family members. And we do that to minimize a sense of waiting and uncertainty. And this can be done through care coordination and referrals. And all these steps can help deal with uncertainty and help reduce the chance of having to have crisis admissions, as well as it can help build a collaborative approach with your care team overall. So what our brains team has been trying to come up with a simple and useful way of identifying the things you need help with for living with brain tumors. And we had kept in our mind the following 3 key aspects. One is we have to make sure routine screening is possible for patients and caregivers. Secondly, we make sure that appropriate care or support is provided in a timely manner. And lastly, but very importantly, we have to make sure that it's easy to access and use for whoever is using the screening tool, whether it's a clinician, you or your family members. So we have developed an online portal that we are hoping to set up as a central point of screening and assessment for things you need help with, which can be used from anywhere in Australia. And this portal is currently called Adapt Brains, and we are it's being modified at the moment, and it's ready for a pilot testing. So when this portal is tested and modified based on the feedback and made available online, you'll be able to gain access to the portal via your healthcare providers. So in the portal, we ask about your level of distress overall, as this can indicate whether you're in need of any urgent help with things, or whether you're experiencing any underlying anxiety or depression that can negatively impact your day-to-day functioning. Here are some more examples of questions that we have on the portal, and we ask you to rate how much over the last month you need help with emotional difficulties, for example, uncertainty about the future, help with the healthcare aspects of things, and whether you need any further information about cancer or treatment. And also we include some items about physical and practical things related to daily living. So we may ask you whether you had any difficulty doing the things you used to do. And then it will be followed up by further assessment if required. And in this setting, your allocated healthcare provider or care coordinator will be in contact with you to discuss to discuss things you need help with and have a plan together to provide support. And this little screenshot is just showing you what your clinicians will see in the portal. So they will receive an alert like that when you complete your questionnaires, and they will be in contact with you to establish care plans or make referrals, which will be also available on the portal. So this makes this allows clinicians to have access to the contact details of healthcare providers or any community support services within your local area, so that they can connect you to a right service based on your responses to the questionnaire. Yeah, so as I said, we are currently sort of policing up this and looking to have some feedback from you on the portal. So we would love to hear from you whether you think it's how you think about whether how you think it looks to you and whether it's easy to use or whether there are any changes that you want to make on the portal. So. And we are aiming to make this available later this year or early next year for use. So moving on, as well as identifying the things you need help with on the portal and connecting you with your clinicians, our brains team is also working on developing support and interventions to address some of the symptoms and concerns that are uniquely challenging in brain tumors. And those concerns can be categorized into emotional, cognitive, and physical challenges. Emotional difficulty is the most commonly reported concern, and this can look like feeling distressed or overwhelmed, having uncertainty, even though this is a very natural response to the very unpredictable nature of brain tumors. Very high level of uncertainty and distress can indicate you may be experiencing anxiety or depression. And to address some of the emotional difficulties, we have developed the telehealth Making Sense of the Brain Tumor program. And this focuses on helping you to understand the brain tumor illness and its consequences and changes. And you can participate in this program while you're on your treatment or after you finish your treatment. And we sort of want to create a safe space for you to explore any existential questions you may have or discuss some of the distress you may be having with dealing with brain tumors or dealing with uncertainty. And in this program, you can have between 6 and 10 individual sessions with a psychologist over telehealth. So you can participate in this program from anywhere in Australia, and the team who is running this program is actually looking for participants who live outside Queensland. So if you live in any other states than Queensland, you're welcome to participate, and this will be available until late this year. Another concern is cognitive changes, especially around issues with concentration, memory difficulties, and finding the right words. So our brains team has developed a memory skills and strategies intervention to help you with some of the memory difficulties. Unlike the teleMAS, this is a group program and you can join this over Zoom. So as before, it's available anywhere from Australia. And we are trialing this intervention to see whether this group online format is feasible or, and whether it's effective for reducing some of the memory difficulties. Physical symptoms are also commonly reported, especially fatigue, sleep disturbances, and generally having a low energy level and motivation to do things. So we found this intervention that helps people cope with cancer-related fatigue by learning about self-management strategies and setting goals. But this has been developed in the UK and for general cancer patients or survivors. So as part of the BRAINS program, we are exploring how we can adapt this so it is more relevant and useful for people living with brain tumors in Australia. Finally, we are also aware that another common concern that people report can be fear of cancer recurrence or tumor progression, which is the concern relating to what if the tumor comes back or progresses. And recently it was suggested 1 in 2 people affected by brain cancer may be experiencing high levels of fear that their tumors will progress. But in fact, this fear of cancer recurrence is actually like on a continuum. So it can range from mild anxiety, especially around the time of scans, to severe level of fear where you feel overwhelmed by fear and have difficulties making decisions or any future planning. So what is available to help with fear of cancer recurrence? Although this is not part of BRAIN's program, this Conquer Fear intervention was developed by another group at the POWH to specifically address fear of cancer recurrence, but a lot of research on this has been done in women with breast cancer or cancer survivors, meaning that they didn't have active cancer or they finished their cancer treatment. But if you are still interested in this program, this is a 10-week program which you can receive from psychologists who have been trained to deliver this program in their clinical settings. So we are actually looking to do more study on this and would love to hear more from you as well to understand whether this has been a problem for you, so that we can sort of look further into how to adapt interventions like Conquer Fear for brain tumors in the future. Sorry, I just... Okay, it's back on, sorry. Yeah, well, finally, thank you for inviting us to join this great time today and to present some of our work on the BRAINS program. We have more information and study flyers just at the back of the room, so if you have any questions or want to talk to us, just yeah, you can talk to me or any of the lovely team members after the session, and we would love to hear more from you too. Thank you.